Bismillahirrahmanirrahim. The next topic in vasculitis section is Buerger's disease. So Buerger's disease is also known as Thromboangiitis obliterans, and it is characterized by segmental inflammation of medium to small sized blood vessels, particularly of the limbs. The most common blood vessel involved in the upper limb is radial artery, whereas the most common vessel involved in the lower limb is tibial artery. So as the name shows, Buerger's disease is characterized by the formation of a thrombus and inflammation of blood vessels, causing an obliteration in the blood vessel lumen, leading to blood flow obstruction and ischemic injury. In more severe obstruction, the gangrene of the end organ, such as hands or feet, can also occur. Thromboangiitis obliterans is exclusively present in the smokers, and there is a male dominance over the females. The disease occurs between 20 to 50 years of age, and the incidence of the disease is highest in subcontinent of India and Asian countries such as Japan and Israel. Coming on towards the pathogenesis of Buerger's disease is rather poorly understood, but it is well established that it involves immune dysfunction and a delayed hypersensitivity reaction to tobacco extracts. The immune dysfunction is characterized by the presence of HLA-A9 and HLA-B5. So according to this mechanism, the tobacco exposure results in, first of all, increased cellular sensitivity to collagen type 1 and type 3, both of which are the constituents of blood vessels. This increased cellular sensitivity results in damage to the blood vessel wall, causing blood vessel inflammation. There is a high titer of anti-endothelial cell antibodies in the Buerger's disease. So somehow the tobacco exposure activates these antibodies which cause blood vessel damage. The tobacco exposure results in an impaired endothelial dependent vasodilation. So lack of vasodilation results in blood vessel occlusion, and there is a high propensity for thrombosis. So all these factors lead to inflammation of blood vessel known as vasculitis and thrombosis, which are characteristic of the Buerger's disease. So inflammation of blood vessels and thrombosis results in occlusion of blood vessel, resulting in lack of blood supply, causing ischemia, and in more severe cases, gangrene of the end organ. Another hypothesis is that the chemicals present in the tobacco directly damage the endothelial cells, causing vasculitis and thrombosis. But whatever the case, it is very well established that the disease is totally dependent upon tobacco exposure for its development as well as its progression. The gross appearance reveals segmental lesions affecting the small to medium-sized arteries, most commonly radial artery and tibial artery. And on the gross examination, a thrombus can also be found within the lumen. The microscopic or histological picture reveals inflammation of the blood vessel wall. In acute inflammation, there is excessive neutrophil infiltration along with the mononuclear cells. As you can see, there is presence of inflammatory cells within the blood vessel wall. So over time, when this acute inflammation turns to chronic inflammation, the inflammatory cells are mostly mononuclear cells, which include lymphocytes, monocytes, and macrophages. The first feature that differentiates the Buerger's disease from other types of vasculitis is that the inflammation often extends into adjacent vein and nerve. Let's say this is an artery, this is a vein, and this is a nerve. So in advanced cases, the artery, vein, and the nerve are encased in fibrous tissue formed as a result of inflammation. This here is a fibrous tissue encasing the artery, vein, and nerve. Moreover, in such advanced cases, the tunica media of the blood vessel wall also gets fibrosed, and an epithelioid granuloma is also formed, which is characterized by the presence of giant cells at the center. Just to recall, giant cells are large cells formed by the fusion of macrophages containing multiple nuclei and extensive cytoplasm. Another particular feature about Buerger's disease is that in this type of vasculitis, the elastic lamina is preserved and it remains unaffected. The thrombus present in the lumen often contains multiple microabscesses within itself. As you can see, there are multiple microabscesses within the thrombus, and often these thrombi get canaliculized. These are the canals present within the thrombus. So the disease exclusively occurs in the smokers, and the early manifestations of the disease include superficial nodular phlebitis, which is characterized by the nodular appearance of the superficial blood vessels, and they are painful. There is cold sensitivity just like in Raynaud's disease, so the exposure to cold results in pale discoloration of the fingers or toes, which later turn bluish or cyanosed due to lack of blood supply. Claudication or pain is also present in the hands and instep of the foot. The pain occurring as a result of blood vessel occlusion or ischemia is known as claudication. And this pain typically gets worse on the exercise. If the pain is also present in the resting phase, it indicates the involvement of the adjacent nerve. In chronic cases, ischemic ulcers are formed on the hands or on the feet, depending upon the blood vessel that is affected. In case of radial artery involvement, the ulcers are formed on the hands, and in case the tibial arteries or its branches are affected, the ulcers are present on the feet. These ulcers over time develop into gangrene. So as you can see, this is a gangrenous area in a patient affected by the Buerger's disease. This gangrenous area is amputated surgically. The diagnosis is established on clinical findings and history of heavy smoking, and sometimes angiography is also helpful. Since the disease requires tobacco use for its development as well as its progression, the only treatment and the most effective treatment is abstinence from tobacco use. So this concludes our discussion about Buerger's disease or thromboangiitis obliterans. If you have any questions, do let us know in the comment section. Thank you.